Hi there, happy Tuesday everybody. Welcome back to my channel with up-to-date news and resourceful information on mental health. If you are new to my channel and you find the videos helpful, don't forget to hit the like button down below. Let's get started with the mental health industry news for this week. Are you having trouble sleeping? One of the largest studies of its kind says that could be strongly linked to mental illness. People diagnosed with mental illness in their life were more likely to have poorer sleep quality compared to the general population. The Center for Addiction and Mental Health, CAMH, said in findings recently published in the PLOS Medicine, which is a peer-reviewed weekly medical journal covering the full spectrum of the medical science. The differences in sleep patterns indicated worse sleep quality for participants with a previous diagnosis of mental illness, including waking up more often and for longer periods of time. Srijoy Tripathi, senior author and an independent scientist at CAMH's Krembil Center for Neuroinformatics, said in a press release, "Poor sleep contributes to poor mental health, and poor mental health contributes to poor sleep," explained Michael Weinberg, the study's lead author and a postdoctoral researcher at the center. Sleep pattern differences were a feature of all mental illnesses we studied, regardless of diagnosis, he said, adding that gauging the quality of sleep was just as important as figuring out its effect on people's mental health. Previous studies have linked people's chronic sleep problems to their psychiatric conditions, including anxiety, depression, bipolar disorder, and attention deficit hyperactivity disorder. But Tripathi explained until now nobody has looked at objectively measured sleep in the context of mental illness at quite this scale before. Michael Mack, a CMH psychiatrist and sleep disorder specialist, said that up to 80% of people with mental health disorders can end up spending more time tossing and turning, or have trouble staying asleep or waking up earlier than they wanted. The Krembil Center for Neuroinformatics is currently in the process of creating a Canadian patient data biobank, similar to the one used in the UK, to drive future clinical research here and ultimately better personalize patients' mental health care. Calgary kids and teens are facing growing mental health crisis as the pandemic drags on. A growing wave of Calgary kids and teens are in a mental health crisis and seeking help in hospital, even as the province's fourth wave of COVID-19 shows early signs of waning. Doctors reported an unprecedented surge in the number of families turning up in hospital in the spring as children struggled with isolation, periodic school shutdowns, and canceled activities. But after a slight lull over the summer, and as the fourth wave peaked, kids and teens just started flooding back in. We're seeing dramatically higher numbers of children seeking emergency department care and being hospitalized because of self-harming behaviors, depression, anxiety, ingestions, and these are really, really concerning symptoms that don't just simply resolve quickly over time, said Dr. Stephen Friedman, pediatric emergency medicine physician at the Alberta Children's Hospital and a professor in the Cummings School of Medicine at the University of Calgary. Pediatrician Dr. Sid Thakor is witnessing it too. "It's absolutely heartbreaking," said Thakor, who has never seen so many kids at the Alberta Children's Hospital in severe distress, including those struggling with severe eating disorders and children who've attempted suicide. And they're much younger than before, he said. We're seeing kids 8 and 9 years old, which is saddening. It's really saddening, the impact COVID has had on kids' mental health. I think we're just seeing the beginning of it, and we're going to be dealing with it for years to come. According to the latest statistics provided by the Alberta Health Services, the number of kids 18 and under visiting the Alberta Children's Hospital ER for mental health concerns has jumped by 36%, from 1,430 between January 2018 and July 2018 to 1,951 during the same period in 2021. Provincially, that's an increase of 14%. The increase in the number of kids and teens seeking help for self-harm, which is counted separately, was even more dramatic. Alberta's Children's Hospital reported 142 of those cases between January 2018 and July 2018, and 342 during the same period in 2021. And that's an increase of 141%. There's been essentially a doubling of youth depression and anxiety during the pandemic compared to what was going on pre-pandemic, she said. During the pandemic, youth have really been in crisis. Kelowna, BC Dance Studio uses movement to improve teens' mental health. Laura Elliott of Creators Arts Centre Dance School in Kelowna has gone out of her way to make sure that her dancers can escape the pandemic and continue to express themselves safely both online and in person. Over the course of COVID, that became a huge part I've discussed with the teachers was how to keep the students connecting and the students talking to each other, and how do we keep the dancing going, said Elliott, who is the artistic director. The physical art form kept the dancers in shape, got them out of the house, and helped them improve their mental health amid public health orders that left many feeling lonely and isolated. It's a creative outlet as well, so you can express any feelings, sad, anxious, or angry, said Mia Stokes, who is a 15-year-old dancer at the school. You can express those feelings through dance without having to speak your feelings. And I don't normally talk about my feelings, but being able to dance with my body in that way has always been super helpful for me. For 14-year-old Maddie Ireland, who also attends the dance class, it helps her work through her anxiety. If I'm anxious, I just love coming to dance. I just feel a lot better because I can express myself differently. It's definitely helped me with school because I don't have to think about just grades and working all the time, said Ireland. Elliott and her team's efforts provided a lifeline for both students and their parents. Getting back into the studio was huge, Nikki Stokes, Mia's mom, said. Mia just started to come back to life again, and honestly, I appreciate it even more, because not having it, she was always saying to me, Mom, I need to dance. Elliott has even become a role model for her students, leading by example to help encourage the next generation of confident, talented dancers. If there is a particular piece of news or a video that you have been watching or listening to and would like to comment on, please feel free to do so on my channel. Also, if you know of anyone who is going through a difficult time and is in need of help or support, I am here for them. As always, take care of yourselves, God bless, and I'll talk to you again really, really soon. Bye for now.